Hello, today is Friday, August 27th, 2021. You are tuned into Proven Cures. I'm your host, Sarah McLeod, and today I'm doing a part 3 to a video series I started in 2019 that covers a protocol. It's actually the protocol for management of the MGUT against HIV virus. MGUT standing for Mutamba, Guazuma, Ulmifolia tree. So basically, this Brazilian doctor, Dr. Gouveia, if I'm pronouncing that correctly, it could be Gouveia or Gouveia, I'm not 100% sure, actually conducted a clinical trial in several subjects. I know that there have been over 100 subjects who have tested negative since starting his protocol for HIV. Actual PCR test coming out negative. But I'm sure there's probably been maybe 100 more or more since then, since that was so long ago that I did the first coverage. I do not know. In the first video, I discussed the plant in general. I got the information from a herbal resource, I believe it's called rain-tree.com. And I discussed what to expect, what it's been used for over the centuries in various countries. I shared its many names in case you want to look it up by other names besides the name used here in the protocol. And I'm actually going to get into that partially here as well. And I discussed contraindications and side effects of its use. That was in part 1. Part 2, I dove into the study itself. And part 2 was a little hard. It was a lot harder for me to explain in English because what I was reading was literally a translation from Portuguese to English. Things were written kind of backwards. The dates were written strangely from what I'm accustomed to as an American speaking English. And my delivery in that video was definitely labored, but it was the best that I could do. Since doing that video, that was December of 2019. So since doing that video, I've had a lot of questions come in, mainly via email, that I didn't feel totally comfortable in responding to. So a lot of people are thinking, oh, Sarah doesn't care, or she does her videos and then she doesn't follow up, or that's not the case. The issue is I want to have a clear answer before I respond. I don't want to come back telling you I don't know and then you feel discouraged. So I continue to do more and more research. So the predominant question that's come in is, where do I get this stuff from? The second, which I've done some research on, I'm going to share here. The second main question is, do I use the powder or do I use the leaves? Now, I remember having read that immunomodulatory effects have been found with the powder. And I've told people that that's the way I would say it. Immunomodulatory effects have been found to be useful with the ingestion of the powdered bark. However, when you go to the clinical trial, it specifically tested the leaves, a concoction of the leaves in the patients, not the bark. So I'm going to go back to that as well. And I got a lot of questions about dosing. How to take it if I have it. How do I take this stuff? It's not in pill form. It's just not clear. Even though I tried to make it as clear as possible. Even in the last video, in the discussion section, I put a little blurb about how to prepare the leaves and everything, but I'm assuming that just wasn't enough. And so I've gone back to do more research. And I actually went back to Dr. Gouveia's site, and the protocol, the first words on the site are protocol for management of the MGUT against HIV virus. And what I found was that the method of preparation that I shared in the discussion section of the second video is here, but he actually goes into greater detail in the overview of treatment. And so that is going to be the primary focus of this video, part 3, overview of treatment. Once we get the leaves, what to do with them. So stay tuned. Thanks for watching. Oh, and subscribe. And this video especially should show you why it's important to subscribe, because research by its very nature is ongoing. we're constantly finding new information. We're constantly updating information. New things come out. As you discover one thing, more questions come up, and those have to be resolved. So that's a reason to subscribe. I also want to give a sincere apology. I know when I first started this in 2018 and 2019, I was very much dedicated to the delivery of new information. And then since I started my doctorate program, I have not been able to deliver as much or as frequently. And so I've kind of been lagging. You know, maybe this is the third or fourth video I've done this year, and it's the end of August. So I just want to explain why that is. Classes start again for me next week. I did find another trial today on allergic rhinitis, so that's going to be my next study that I share. But anyway, this is part 3 of the Mutamba trial for HIV, and stay tuned. Thank you for being. All right, so I'm back now, and like I said, I'm going to, first thing, let me tell you where I actually found where you can get a blend of the leaves and bark. You can probably get the pure leaves there as well. Etsy, the merchant, the big merchant that allows small business owners to sell their wares, etsy.com. So you would go to etsy.com, look up, and actually I'll tell you what I found. I have my computer in front of me as usual. I'll tell you exactly what I found on Etsy. So on Etsy, Mutamba didn't come up, but Guazuma Ulmifolia came up, and also another name for it, an English name for it, West Indian elm, which is something I had mentioned in part 1 of this video series. The leaves and the bark ground into a powder for $14.99. Actually also see a bunch of other things here, different leaves and things. The cool thing about Etsy is you can send a message to these sellers saying exactly what you're looking for, and they can do custom orders for you. So if you don't see exactly what you want, and this is a herbal store, specific herbal store, they can find it for you and work out a price and how to get it to you and everything, because it's not like you're purchasing from a large manufacturer. You know, this is or like a GNC or something that they just have their set list of inventory and that's it. No. These are personal retailers who are willing to work with people, you know, who need something specific. So try out etsy.com and let me know how that works out for you. If you also, likewise, like I normally will get my herbs or supplements from amazon.com. But as I pointed out in previous videos, amazon.com has this list of countries that it does not deliver to for various reasons with customs and stuff like that. But with Etsy, since you're dealing with personal, private sellers, that is something that can probably be worked out separately as well. You might have to pay more for shipping or something, I don't know. So that's my answer to that question. Where do I get this? Where do I get this? That's where you get it. So now I'm going to go over the overview of treatment per what is here on the website, published by Dr. Gouveia and his team. And I am going to link this website also in the discussion section of this video. All right, so overview of treatment. Once again, this is Portuguese translated into English. I may have to reread some things if they do not read out clearly. I'm going to read verbatim as much as I possibly can, so I don't mix things up or say them inaccurately or give misinformation. Due to certain, now I'm starting to read. Due to certain irregularities in the year, due to rainy season or droughts, the leaves or Mutamba Guazuma ulmifolia, where the extraction differs greatly in size, causes problems in processing. Therefore, a standardization of protocol based only on the size of the leaves was performed. Using leaves of an average size meaning 8 centimeters in length, or if available, leaves of up to 16 centimeters that are cut in half and are worth 2 leaves within the protocol as a rule. So, okay. So now the first thing he does is define the size of the leaves as being 8 centimeters, and if he was able to get larger leaves, he would cut them in half, just so that he can standardize the protocol. Standardizing meaning make it something that can be applied to everyone. Everyone can use it or figure out how to use it. Okay? The project makes always sending to the patients of 350 leaves to effectively complete treatment. So if you don't know how much you need, there's your answer. You need 350 8-centimeter leaves. Because people, feel the need to be very specific, especially in terms of treatment and dosing. And this allows you to do that. Now, this information was not on the website in 2019. So I'm sure he's had a lot of questions that you guys fielded to me. And this was his way of trying to clarify things for everyone. Now, in terms of preparation of the leaves, a lot of questions came in about boiling the leaves. I rewatched the part 2 that I did of this video series, and I recall saying in that part 2 to boil the leaves. I would like to say if I said to boil the leaves, it's because that's what I read. I never share something that, because I don't want to mislead people. So I never do that. I'd rather not answer you than tell you the wrong thing. But here he clarifies. So listen up. The leaves should be fully crushed or blended. I do remember saying use a blender. Totally, and mix with a portion of pure water. So that means purified water. And then build a solution or substrate potent chemotherapy. Don't let that word scare you. That means cellular destruction. Okay, so he's saying here, right, destroying the virus to chemical molecular level. He clarified that. So what he's saying is, do not mix the water and the leaves in some bowl or cup or something and drink it as a tea. That's not what you want to do. You want to completely macerate. Is that the word? I think, yeah, macerate those leaves, completely crush them out so that they blend in with the water. It makes a difference, apparently. And he said, this is the protocol described to be applied in people infected with the HIV virus, but for only 30 days. This is another question that came into me that he answered effectively. It can be accompanied by standard treatment of ARVs or ARTs, antiretroviral therapy. Conventional parallel without any problem if the patient is medicated. This treatment does not interfere with current conventional medicine. I would like to clarify, antiretroviral therapy is meant to suppress the virus. What Dr. Gouveia is prescribing is a method to ameliorate the virus. So the two have different functions. Do I know if one can, if the Mutamba can replace the ARV? If you've already started ARV, or if you're suffering from symptoms of HIV? Answer is no. You still need to repress the virus in your system in order to stay healthy. Okay? So, and I've had that question fielded to me as well in emails saying, should I, take the ARV or should I just stick with the leaves? And I always tell everybody the same thing. Take your prescribed medication because you don't want to fall sick. Okay. Recommendation now on the storage of the leaves. This is also important. The way to store the leaves, as you immediately get them, must be placed in the freezer or refrigerated to maintain their status. All right. So now, protocol description of liquefied leaves. MGU tannin, the ingredients. And this is what I initially had posted. So I'm going to just go over this one more time, because in 2019 we didn't know what size of the leaves to use. So now he's saying you're going to have, at one time, 50 leaves are going to be used. He said you won't need more than 350 leaves to have a full cure. So common sense is telling us now, or basic math is telling us, this is going to be 7 administrations of this dose. Right? 7 times 50 is 350. So now you're going to have 50 leaves at this size from the tops of mature trees from the Mutamba, Guazuma, Ulmifolia plant. Okay? Added to 1.9 liters of pure water, which can be bottled or tap water without gas. That's just what it states. And this amount will serve for exactly dosing for 5 days for one patient. How to prepare. In a blender, place 50 of the leaves. He says in parentheses, what is desired is that the leaves result completely crushed and liquefied without discarding much of the product after the purification process. Okay? So you want to, I guess, puree, because you want to liquefy these leaves. And then, right, so you're going to liquefy the leaf, 50 of the leaves in a blender with 400 milliliters or 0.41 liters of natural water. Liquefy until you completely crush up the leaves, leaving a compact mixture. And then to proceed to percolate it in another container. Then, over the liquid which is percolated and in the container without impurities, add 1500 milliliters, which excuse me, which is also equivalent to 1.5 liters of pure water. So you're going to add 1.5 liters of pure water to the percolated mixture. This will result in 2 liters of the total preparation. Once you have that 2 liters, you're going to empty the contents of the juice in a jar and keep it under refrigeration in order to preserve it. This preparation should be consumed in exactly 5 days, according to the dosage described. Okay? Now, dosage or administration. The patient must drink the measure of an American cup of 200 milliliters or 0.2 liters every day for 30 days, twice a day, with 12 hours in between each dose, without fail. So that means if you take it at 8 a.m., you take it again at 8 p.m. On the dot, on time. On the dot, on time is always important when fighting a virus, because the idea is to keep the virus from replicating. When you miss doses, viruses get stronger. They replicate, they get stronger, they get harder to kill. They also become immune to whatever is being used to kill them. So it's important always, especially the HIV virus, to be consistent with your medications. So you should drink a dose of 400. Oh, and I'm saying this because I worked in HIV research for many years. I also trained with the Centers for Disease Control in understanding the HIV virus, its etiology, its treatment. So that's why I can speak so soundly about its treatment. You should drink a dose of 400 milliliters for a day, divided in 2 doses of 200 milliliters in a day every 12 hours. So that's basically reiterating what I just said. And then he goes on to say, for example, you could take 200 milliliters at 7 a.m. and then 200 milliliters at 7 p.m., totaling 400 milliliters per day. Same thing. Okay, now time management. The patient must finish. This is really great because none of this was on the website in 2019. This really speaks to the concerns of individuals, and it shows that, you know, maybe a lot of you, I know, were thinking that I was ignoring you, but I really wanted to get the real information first before responding. But this shows that your questions are common because he's actually answering all of your questions here. So that means the same questions you fielded to me, you received them as well. And I'm so glad that this is translated to English, although it's still a little hard, but the information is here. So this is pretty cool. So time management. The patient must finish the preparation of 2,000 milliliters, 2 liters, within 5 days as stipulated. Then should proceed a day before it is finished to preparing. Okay, so the day before you finish that, prepare another 2 liters. So you'll have it available for use so you don't run out. Okay, for the next 5 days. And you're going to do that until you use up your 350 leaves. Okay. The treatment for patients, he reiterates, the treatment for patients with HIV virus only has a duration of 30 days. The project provides a batch of 350 leaves, which are for treating patients just for a period of 30 days of medication accurately. Oh, so he's saying 300 leaves are expected to treat. The additional 50 leaves are for the case of, in case you miss a dose or something like that. For the case of missing the same, for any reason or anything that comes up, maybe you had to be away from home, you weren't able to, I don't know, use your mixture at a specific time or something, you need to mix something up real quick, here's 50 more on the side just in case. That's so the fifth, so it's really 300 leaves is what you need, but 350 is just so you have a little leeway in case, you know, life happens. It says if you have leftover leaves after the treatment, they can be prepared in the same way to finish what's available, but the strict rule is that 300 leaves should be consumed within 30 days without stopping or pausing. Okay. And he goes into contraindications, which I'll discuss here. I'll share it here verbatim as well. Being a drug effect of strong natural chemotherapy in the treatment of various viral diseases such as HIV, it cannot be administered to pregnant women or in infancy. This is also a discussion that came into my email, and I strictly advise this woman to go with her doctor's therapy. Do not do this because she's pregnant. It's just not a good idea. And she argued and argued and argued and argued with me. I am so glad now here the doctor is saying the exact same thing. I hope she's watching this and didn't take what I said hurtful, that I was trying to be helpful. If you are having a baby, it is best to go with what your doctor wants for you, because your doctor can be able to monitor the health of that child. And what also I want to add, what was a little frightening, was that she wanted to do this so that she could breastfeed, with breastfeeding being a main primary mode of transmission of the HIV virus. It is definitely not recommended. I do not know what her financial situation was. I do understand globally that breastfeeding is, you know, a way of feeding your children free of charge. And so that could be a reason why she insisted so much that she wanted to breastfeed. I have no idea. But it's very dangerous to a baby when you are HIV positive to breastfeed. So I hope she's doing well if she sees this. I send my blessings. But Mutamba is not something that is recommended for a woman who is pregnant. Also, in part 1 of this video series, I did explain that Mutamba has been attributed to causing contractions, stomach cramps rather, and so it is also contraindicated in people who are pregnant, or if you are premenopausal and you happen to get a lot of cramps when you get periods. It might not be such a good idea at that time either. He continues to say that it is prudent to wait for pregnant women to finish this stage, give birth, and then proceed to treatment for 30 days. It is also inadvisable for people with severe kidney disease, and in fact, he uses the word backfiring. I don't quite know what he means by that. If he means that it'll worsen the kidney disease, or if it simply will not have the same efficacy against HIV. I'm not sure what he's referring to with the use of the word backfiring. But if you have kidney disease, don't do this. It is also recommended intake before testing on the skin or a few drops in the mouth to see if you have an allergic reaction, which is normal because it is a herb. You don't know what it is. The powerful natural chemical medicine is referred to as a tannin. So if you know already that you have an allergy to tannins, tannins are a chemical component of teas, especially black tea. So that's something that you have to stay far away from. I believe green tea has a high level of tannins, but I know black tea has a higher level because of the color of the tea or something. But this can cause a severe tannin allergic reaction. So if you're not sure if that's an issue for you, he recommends doing a small skin test or putting it inside of the mouth where the mucosa is to see if you have an immediate reaction to it or not. Recommendations and observations on the treatment. So after application of the tannin for 30 days, patients should only be making a new test or a viral load test after 90 days. And have used, I'm sorry, it's in English, but it's still not written, in the clear American Standard English way. And have used MGU tannin should be emphatic about this. The test review will result in a significant decrease in viral load, an increase in the number of CD4 and CD8, and improvements in CBC complete blood counts or hemograms. So he's saying even though you complete your protocol in 30 days, don't get tested again for 90 days. After 90 days of application, patients should only be making a new test or a viral load test after 90 days of application and have used MGU tannin. So the way I'm reading this is 90 days after the last dose is when you should test your viral load. He goes on to say, if the test is performed before the 90-day average, you will not see any apparent change because it is in full cell recovery still in the patient. Taking MGUT by 30 days results in disabling the virus and its destruction and complete inhibition at 100% and reverse transcriptase mechanism of the virus. After 8 or 9 months after having taken the last dose of the Mutamba, the patient should be performed again viral load test. So you get your first viral load test 90 days after your last dose, and then again 8 or 9 months after your last dose to analyze, and you should experience an undetectable viral load, he says. Treatment time, of course, is only 30 days. He repeats that again just to make sure you understand. So you're going to Drink this concoction. I won't call it a tea because no heat is applied. There's no boiling going on. But it's a blending, right? It's blending of leaves and water. So it's the concoction. You drink this for 30 days, as I described. You do your first viral load test 90 days after your last dose. So of course you're going to keep a calendar, write everything down. And then you do a second viral load test 8 to 9 months after your last dose. What I would recommend is taking this, go to the website that I'm sharing in the discussion section, print this out or take it to your physician if you want to follow the protocol. Of course you have to have an open-minded physician. You can even take it to a naturopath. So you, as is recommended, you would still take your antiretroviral meds, right? You're not going to stop doing that. But you are also, if you want to follow the protocol, follow it with a physician. The physician can order your viral load test for you and make sure, you know, things go according to how this is written. Your physician may even reach out to Dr. Gouveia himself for further, you know, discussion or more information. It's always good to go with a physician. That's what this is. This is not just, you know, for you to renegade, try and take care of yourself. This channel offers options via research. So you know what other things can be done. And you can work with your doctors to try new ways of treatment. New ways that your doctor may not even know about. Because remember, your doctor is seeing X amount of patients, probably a whole bunch of patients all the time, mainly following, you know, 1 or 2 sets of protocols for treatment, and not necessarily up on or abreast of the latest research in the field. They don't always have that information. So if you go as an educated consumer and bring this with you, either on your phone or your computer or on paper, physicians respect research. Physicians respect research, and because the research is coming from other physicians, and maybe you guys can work together to try something new, if that's what you want to do. But I'll never tell you, oh yeah, run out and do this on your own. No. How are you gonna get your tests? You can't do this on your own. So he goes on to say it's the same thing. 90 days and then 8 or 9 months later. He says these tests are necessary for the control of the patient and scientific equipment. The latest tests done at 8 or 9 months certainly throw an already undetectable viral load. So basically what he's saying, the tests at 8 and 9 months are to confirm that your viral load remains undetectable. Now, I know what you're probably thinking. If I am sticking to my antiretroviral medication, I can already have an undetectable viral load. This study was conducted in people who were not, I'm sure some people were not taking ARV, and they were still getting undetectable viral loads. So keep that in mind before you shoot it down and you're like, oh, well, if I'm just trying to get it, because you're not just trying to get an undetectable viral load. The reason why your conventional medicine will give you an undetectable viral load is because it is effectively suppressing the virus. You take the medication at the right time every day for the rest of your life. The point of doing this protocol is that you don't have to take it for the rest of your life. The point of doing this protocol is to kill the virus in your body. Remember that. That's the difference. He goes on to say, it is not recommended to alter this protocol in its administration or preparation. The leaves should only be liquefied. The leaves should not be boiled or cooked or prepared in tea or brew. Why? Because it loses force and effect. The leaves should be prepared crude as described. The application of this protocol as described removes the whole virus from the human body. He goes on to say, the Mutamba treatment is not a vaccine against HIV, but results in therapeutical cleansing of the virus from the patient. It should be applied when you are infected with the virus to remove it. The treatment does not protect against a new infection. So if you are in a situation or an area where you can easily be reinfected, it is up to you to exercise precautions against that in whatever way possible. It can clean the virus from your body, but doesn't mean you won't get it again if you are in the same situation that caused you to get it the first time. He says in case of reinfection, treatment can be repeated and it should be repeated. Immediate benefits on the patient. Patients under this treatment in the first 90 days after treatment administration will experience a significant increase in the number of blood platelets, increase in your lymphocyte count, those white blood cells that you need to fight infections, and strengthen your immune system. And this will be reflected in your blood tests that you have 90 days after the last dose of treatment. And this concludes this video. Thank you for watching. Once again, please subscribe, like, share, leave comments. I hope this clarifies a lot of the questions you had for me. And be blessed. And like I said, the next video I'm going to do is going to cover a research study I found earlier today on allergic rhinitis. Okay, thanks for watching. Also known as sinusitis. Thanks for watching. Bye-bye.